There are so many guys who have the most perfect lab work that you could possibly get them and the most perfect protocol, but they still have these, what they would describe as negative symptoms. And a lot of the time it's related to diet and lifestyle. But the other thing that we also have to take into account is that a lot of the time it's to do with these maladaptive processes that have come and arisen, or just the man turning into the being that responded to the low testosterone and the low hormonal environment that he experienced for many years. And I see this being particularly devastating for the younger guys who never had that optimal testosterone level to begin with. Not only physiologically did they not get this androgen saturation when they're supposed to, but also in their early 20s, they didn't get this sense of wanting to take risks and take on the world with courage and bravery and all of these things that testosterone is so important for. And as a result, they become meek and afraid and maybe involuntarily introverted, not because they prefer their own company, but because they're so afraid of the world around them. And they develop this learned fear mindset. So they come in with this idea that, oh, once I get my testosterone levels up to the optimal masculine level that they should be, then all of a sudden I'm going to become that optimal masculine man. And then when that doesn't happen after 12 weeks, maybe 6 months, maybe a year, depending on the guy, they think, oh, well, I just must need more testosterone to be more masculine and manly. And I have found that that's just not the case. It would be great if that's how it works, but it doesn't. And what's very important that I like to explain to these guys and go, look, if I fix your car, it doesn't make you a better driver. It might make it easier to become a better driver, but you're still going to need to go and learn those skills. But now that we've fixed the car and the car's not malfunctioning, now you can go and learn how to become a better driver, and it's actually going to work. Same with diet, same with lifestyle. It's like if we fixed the foundation for the house that kept falling down, you still have to go and rebuild the house. And I think the hard thing is that if you've tried therapy and you've tried diet and you've tried exercise and it's failed 10 times because you had a low hormonal environment, it takes a lot of courage and a lot of bravery to go, I'm going to go try this thing again that didn't work before, but this time I know it's going to work. That is so difficult to do, but you have to do it. It's like stretching. It's like eating well. It's like all of these things. It's like they're difficult, but they're doable, and you have to do them. And that's the thing that I think is important, is that there's this interconnected relationship between the biology and the psychology. And it's much easier for us to come in and fix the biology, but the client or the patient, they've got to go out and do the rest of the work and meet that medicine halfway. And I think that a lot of the time guys are looking for the shortcut. They're looking for the supplement. They're looking for the magic snake oil thing that some guy on YouTube's going to sell them, which is all just a load of crap. And at the end of the day, it's stuff that we say TRT takes time to work. It does, but it also takes time to do the work that needs to be done. And if you're particularly far off track, it's going to take you months, maybe years to get to the point that you really want to get to. And all we can do is lay the foundation for you to do that.